Now, the CDC says cold season is here, and they expect a rise in flu and COVID cases as well.
And there are plenty already. This comes as many people are going to be getting together for the holidays. So we're talking more about infectious disease with an infectious disease specialist, Dr. Larissa Pisney from UCHealth, joining us now. So flu and RSV, you say there's still a ways to go before we hit the peak, but we're ascending, sadly.
Yes, so I would say we started to see the rise of flu and RSV, especially after people started to gather for Thanksgiving, and then they've just continually been going up. Flu, we usually see at least like one period of time where it's a steep rise, and we really haven't hit that yet. So still think we have plenty of respiratory virus season to go.
Are you seeing more flu or RSV or COVID? What are you seeing the most cases of right now?
Well, we've consistently had, in terms of admissions, COVID admissions have outpaced the other two, but flu is starting to catch up. So definitely something we're keeping an eye on.
I know at least 3 or 4 people that had their very first case of COVID this year, this fall. You know, managed to dodge it all along, and then I think the masks and everything else. But we've been reporting that people aren't getting those vaccinations, COVID and flu.
Yeah, so nationwide, CDC reported that vaccinations are down even compared to last year. And then the RSV vaccine, which was new this year, only 16%, approximately 16% of eligible people have gone to get that vaccine.
I know we have a lot of discussion about fatigue over, is that it? Fatigue? What is it? Laziness, procrastination?
Well, I think it's a combination of things, and definitely misinformation plays a part. I think the most important thing to remember with these vaccines is that you may still get sick, may still get the flu, but really the goal of them is to prevent hospitalization and death. And they do a very good job at that. And so I would say as cases are rising now, there's still plenty of time to go get those if you haven't already.
So in the old days, like 3 or 4 years ago,
people
would oftentimes say, I'm not getting the flu shot because it gives you the flu. You know, it makes me sick, things like that. But once we got into COVID and the vaccination war, the political push and pull about vaccination, do you think that's impacted people as far as getting the flu vaccine as well? I mean, are those numbers reading that vaccinations have become not unpopular, but let's just say polarizing?
Yeah, I think it's definitely a polarizing topic, and I think it's, for healthcare professionals, very important that we continue to try to dispel any fear or misinformation that exists out there. When people say they get the flu from the flu vaccine, for example, I talk about this all the time with patients. Your body, the immune system is having a similar reaction to the flu vaccine that it would if you got sick. It's essentially recruiting all these helper cells and antibodies. And so, yeah, it's normal to feel a little achy and poor the day after a vaccine. And I think that's one important thing for healthcare providers to tell patients so that it's not surprising if they do feel that way.
You know, we've been talking about, I mean, families are gathering, and then you have kids that tend to bring all kinds of things. What's your advice to folks if they do start feeling sick? I mean, I know that one of the things is call right away, see if you can get an antiviral. What else?
Yeah, I think there's a few things around the holiday gatherings. One, if you're not feeling well, it is important to get tested, and then don't go. Exactly. Don't go. But especially if you're someone who's higher risk, so over the age of 65, certain medical conditions like heart or lung disease, cancer, immunosuppressed for other reasons, really important that you contact your healthcare provider to get tested, as there are treatments that are available that can keep you out of the hospital.
And finally, just real quick, measles, the report from out at DIA, is that alarming, concerning? What would you want people to know about that?
Well, what I would want people to know first is that measles is a vaccine preventable disease. We did at one point eradicate measles from the United States in 2000, but as vaccination rates have dipped, childhood vaccinations, it's been able to reemerge. I don't think that people should panic in terms of the measles. Local and state public health are doing a round-the-clock job to notify those who had close contact with this individual and get in touch with them. But just really important for folks to know that this is a disease that can be prevented with vaccination.
Had been. All right, Dr. Larissa Pisney from UCHealth, thank you so much for coming in today. Good to see you.
Yeah, thank you so much for having me.